In this video you will hear about the key findings from an evidence review, which explored the relationship between workplace learning and well-being. This review brings together evidence from studies which evaluate how learning outcomes and learning processes in the workplace impact on the well-being of individuals. There is a statistical association between learning and well-being identified in survey evidence and existing reviews, but the causal mechanisms behind this association remain poorly understood. In our initial public consultation, which informed the focus of this review, workplace learning was identified as a valuable way of helping workers to cope with stress at work, as well as helping them to develop work skills. Existing evidence is limited to macro studies of large-scale datasets and reviews of learning that specifically targets well-being, for example, mindfulness training. There is then a limited understanding of the causal effects of learning and the role of the learning process and context in supporting well-being. Our key research question was, within the context of work, to what extent are well-being outcomes influenced by learning outcomes and the characteristics of the learning process? We addressed this research question using a systematic review methodology. This involves systematic searches of academic databases using key search terms to identify studies evaluating the well-being effect of work-based learning. Taking into account the gaps in the existing evidence, we only included longitudinal intervention studies that give the best evidence of causality. To ensure the evidence was applicable and rigorous, we also only include peer-reviewed research and studies which took place in a similar context to the UK. Throughout the searches and sifting process, members of the review team cross-check decisions to ensure convergence. This diagram shows the progress of searches carried out for the review. As you can see, we started with 4,457 studies and systematically worked through these to exclude all those that weren't relevant to the review. This left us with 41 studies, which were included in the final review. We sorted the final 41 studies into 4 groups based on the type of learning process or intervention they sought to evaluate. For each of these groups, we classified the evidence as strong, promising, or initial, and summarized the key findings in an evidence statement, which are presented over the next 4 slides. The strength of these evidence statements is based on grade and circle guidance. For further information on these classifications, please see the What Works Centre Methods Guide, which can be found on the website. Because there are only 3 studies in the final group, learning interventions at an organisational level, we could not come to any firm conclusions and therefore don't present any evidence statement in relation to that group. Adding to the existing evidence base on the effectiveness of training to develop personal resources for well-being, or well-being skills, our review confirmed a wide range of approaches were effective in the workplace. Interventions we looked at included cognitive behavioural therapy, resilience training, mindfulness and sleep training, amongst other approaches, and we did not observe any significant differences between them. Although we rated this evidence statement as strong, there were some limitations in the group of studies that evaluated personal resources learning. Firstly, they tended to target people who were more receptive to this kind of training, and there was a lack of studies with longer-term follow-up measures. So the evidence base needs to be developed to fully understand how effective this kind of learning is for well-being in a wider sense. We found evidence that professional learning, such as evidence-based practice for mental health workers, can be effective in enhancing well-being. However, there was a stronger evidence that there was no well-being effect from this kind of training. There were 6 studies showing no effect versus 4 showing a positive impact on well-being, and those showing no effect had stronger designs. Overall then, the evidence is quite limited in this area. Therefore, we rated the evidence statement as initial. The review only picked up studies from the health and social care sectors, where professional work skills and well-being skills tend to overlap. There were also a number of studies with relatively small sample sizes, and process or contextual factors such as high staff turnover may have confounded effects in some cases. Finally, the well-being effects of this kind of training may be challenging to trace, since professional training would be regarded as important for career and income progression, and that is likely to have important well-being effects. In the case of training for leadership, we found that although this can be effective in improving well-being, half of the 6 studies also showed no well-being effect associated with the training. Furthermore, the evidence for no effect was slightly greater, as the studies showing no effect had stronger designs. Again, we rated this evidence statement as initial. The 3 interventions which did show an effect all used learning processes which were more interactive and reflective, in contrast to the interventions showing no effect, which relied more on online self-directed training. This suggests that the nature of the learning process was important. The importance of process is reflected in our final evidence statement presented in this video. We examined all of the studies that evaluated the 8 interventions using online methods. 5 of these had no effect on well-being and 3 had a positive impact. Some of these interventions relied entirely on online learning and none of these were effective, whereas interventions using a mixture of online and face-to-face learning had mixed success. Some had a positive impact on well-being, some had no impact. We rated the evidence statement as promising because the studies supporting these findings all used strong designs, and there was some consistency in their findings, in that those using more online methods were less effective than those using more extensive methods. Our review also highlighted key gaps in the evidence base on learning and well-being in the context of work. Despite the large range of learning processes taking place at work, very few intervention studies measured well-being outcomes. Although learning is widely believed to be good for well-being, there is little evidence on the longer-term impact of learning on well-being. Very few studies tracked impact beyond 6 months. There is also little understanding of how these impacts might translate into cost-effectiveness. There is then a need to broaden and improve the evidence base. Particularly useful would be stronger evaluation studies that use randomized control group designs to address the issues of selection bias and causality. The evidence around the effectiveness of professional training in enhancing well-being was very limited. This is surprising, as it could be a major opportunity to boost well-being, job performance and satisfaction with work. The context in which learning takes place and the learning process are likely to be important in defining their success. Whilst tailored learning interventions and programs will be more expensive, they may be more cost-effective in the long run, if designed well. Thank you for watching this presentation, and if you would like to know more about the evidence reviews we have been carrying out, there is more information on our website. Here you will find a number of briefings and reports that summarise the evidence we have been gathering on what works for well-being.